Thank you. Ladies and gentlemen, at the outset, I would like to sincerely thank the organizers for inviting me for this prestigious conflict and reposing confidence in me to moderate this important, interesting, and contemporary panel discussion. Thank you, Dr. Bhatia, Rakesh, and other members of the organizing committee for this. So before really getting into the panel discussion, I take this privilege, somehow or the other, let the doctors, let the healthcare professionals, let the clinicians play their role and not Dr. Google. That is something which will have adverse impact on the healthcare of people. The other thing which is going to happen is to shift to home and community, where hospitals will evolve into hubs for acute trauma care, while routine care shifts to home-based virtual or ambulatory care settings. I mean, that's what all corporate hospitals are looking for, and I'm sure that the government will also get into with their medical colleges and hospitals in the future. It is basically, if we talk about building a resilient health system, and it's a digital infrastructure, establishing a robust, interoperable data system. We have been listening to this, that platforms need to be interoperable. It's not in silos. It needs to enable real-time surveillance and telehealth, more of diversified supply chains, moving away from a single source reliance for medical products to ensure stability during the crisis. And this is what we have learned from the COVID times. Investing in mental health for workers, offering flexible work models, and upskilling staff for the digital tools will also be something, an integral part for the future of healthcare. The whole society approach is where engaging local communities and leveraging social infrastructure, not just for clinical settings, but as a routine. The health and wealth connections. What is that health and wealth connection? It's more of an economic impact. And a study shows that a 40% reduction in global disease burden is possible through existing intervention by 2040, potentially boosting the global GDP by $12 trillion. I mean, that's going to be the economic impact of the future. The well-being as productivity, because proactive mental and physical health support directly impacts workplace productivity and reduce absenteeism, and therefore it has got a direct link with economic outcomes of organization or of the nation. The focus on health span is designing health system to support a multi-generational workforce focusing on living and working longer. It's not just living, but it's also how can we work longer. And what are the action plans for the next decade? It's basically, yes, we need to embrace digital transformation for virtual care and remote monitoring. Yes, to the extent that it is required, not to overshow or overplay with that. A shift to value-based care where reward outcomes, keeping people healthy rather than the number of procedures that we do. That's what we heard even in the last panel discussion. Strengthening public health, it invests in preventive care and community-based healthy networks. That's what's required. And prioritize trust and data security, address the cybersecurity to protect patient data and maintain institutional trust. So that's something which we need to take care of. Now we go to the panel discussion. Thanks for listening to the setting the scene for this discussion. So let me start, Dr. Chatterjee, with you. We hear the term wellness, but what it really means, I think there is insufficient understanding of the term wellness.
Yeah, wellness, I mean, everyone says health and wellness. Of course, I mean, the two are linked. But what is wellness? Wellness is possibly a state of happiness of your mind. You see, you're healthy, you don't have problems, you're able to work, you're able to be productive. And that requires a certain amount of discipline. Now, it's like having an, what should I compare it to? A roommate who's, little over the top, who will exercise when he feels like it, he needs good hydration, he needs, adequate diet, healthy eating, and he would require a good amount of sleep. But what does he do? He does this all in his time, and he's happy doing it. That is what makes him well. It's not just the absence of disease or infirmary. That's not wellness. The wellness part is really focused on the fact that, are you happy with yourself? Are you a person who can be totally independent and be absolutely satisfied with whatever you are in your own being? Now that is wellness. So therefore, I mean, this disconnect between health and wealth and that, it's great. I mean, how are you going to be wealthy if you're not healthy? You're in a hospital all the time. So how on earth are you going to be healthy? So I think that's where it comes from. I think it's a state of happiness of the mind. There I am within myself, content. No, that's wellness.
Thanks, Dr. Chatterjee. Jignesh, would you like to add something to what Dr. Chatterjee just mentioned about wellness?
As he rightly mentioned it, I'll just add it from my own experience, not from the health professional point of view. So for me, what it means is my routine starts at around 4:30, 5 o'clock in the morning. I go to gym for 1.5 hours, then I come back and then I do some meditation and then start my day at office 9:30 to 7:30. And then in the night, again, I spend around half an hour, 45-minute walk. So at the beginning of the day and at the end of day, when I close my day, what makes me happy is something which I feel from my within. And that's I totally connect it. And what I am doing as part of my discipline, which is making me or making my inner self very strong, it adds a lot of value in terms of my energy throughout the day, my high in terms of motivation or self-inspiration. So that's itself is a wellness, what it means to me.
Thanks, Jignesh. So, Jignesh, just talking about that, when we talk about health, wealth, and well-being, how are developed nations integrating these three pillars, and what can India learn from them?
Very good question. So here, as part of the developed countries, we always talk about US, UK, Japan. But for a change, I would like to talk about Australia. Australia is about to be declared as cervical cancer-free nation in maybe a year or so. And the reason for it, their early adaptation of HPV, that is the vaccine which is available for cervical cancer, and early adaptation of cervical cancer screening. So if we talk about Australia or developed countries versus India, in India, if you talk about cervical cancer screening, we are at less than 2%. For the matter of fact, cervical cancer which is the second most common cancer in women in India, it is absolutely preventable. Because the 99% of the cases, the cause of this particular cancer is an infection. An infection which is because of HPV. So what I'm trying to say to answer your question is there are a lot more things which are happening in the developed countries, and in India we have just started about it. It's not that we are not doing it. The good example is universal immunization program, which is absolutely in the form of prevention. And now India is about to launch cervical cancer vaccination also. India is about to launch massive cervical cancer screening as well as all non-communicable disease screening. So it's happening, but that's what India is setting for the decade.
Right, Jignesh. Dr. Chatterjee, I mean, talking about cervical cancer vaccine, I think cervical cancer vaccine has been launched quite some time back in this country. But still, there is no decline in the rate of cervical cancer. What, according to you, has gone right or wrong with the promoters of cervical cancer vaccine or by the government?
So do you remember that way back in the 50s, we had launched a malaria eradication program?
Right.
And you see how well it has been eradicated? We still have cases of malaria in thousands.
Right.
So, you're talking in terms of cervical cancer eradication. Well, fine, okay. We've achieved one, and that is polio. But what it needs is political will. Now, there is complete lack of political will, as you see in the last budget. What is the health spending? 1.9% of GDP. What does India spend? 5.8%. Where does the rest come from? Private players. So if the government itself is apathetic to the fact that, oh, we've got 1.4 billion, now how are you going to tackle it? Well, then that's exactly the problem. You don't have the political will to ensure that this happens. What happened in the malaria eradication program? Half the DDT was mixed with kerosene, and that was sold in the black market. No, I mean, come on. If you're going to be doing all of this, then in that case, how are you going to achieve any program? Now, oral polio, as well as tuberculosis, there's a shift now that is, most people feel that if you have, at birth, you have BCG, then you're immune. You're not. It's only for 13 years. And thereafter, you have to have another booster dose, which the government should have put many moons ago. But there is a complete lack of political will. You want to make something successful? Have the gall to put your foot forward, invest heavily, and then you will find the success. Otherwise, you will never have it.
I agree with you, Dr. Chatterjee. I mean, it may not be financial investment, but actually it may be a mode of awareness investment. It, like in the case of
You
HIV.
need financial investments,
Yeah.
sir. It's not a question of the money. The money has to come in.
Yeah, it has to.
How are you going to drive the program?
Yeah.
So it's not a question of will. It's a question of put your money where your
Mindset.
mouth is.
It's more of a mindset. We cannot keep on talking we are a country with so much of population, but we really need to address that. Fantastic. Thanks for that. So, Dr. Chatterjee, do you feel that it's alternative medicine which will be more in demand than the allopathics in
At
the
some
future?
particular point in time, it's going to be something called a complementary medicine. You have ancient Indian medicine. Now, Shushruta, he used to do, in 5000 BC, he would do a cataract surgery with a lancet, milk, and honey. Now, his Samahita was lost. And I gather that there were the invaders who would come in and they burnt all of it, but we have retrieved some of it. But the point is that if you combine allopathic medicine and homeopathy or Ayurveda, you may get something which is called complementary medicine. We complement each other. So you see, where I fall short, you take off. And both of us together can make a huge difference.
Absolutely, absolutely. Thanks for this. Because people were thinking of either this or that. But you rightly mentioned it's more of a complementary stuff which is there. So, Jignesh, I mean, a lot of things are happening globally. The healthcare systems are shifting from from treatment to more of preventive medication. So, how do you see this trend evolving worldwide, and where does India currently stand in this?
Very good question. So I'll talk this from the two angles. One is the upper class economic strata, and another is the bottom of the pyramid population. So when we talk about the upper class population or the corporate world, the employees or the workforce point of view, the trend has started evolving where the Indian corporates have started accepting the preventive mechanism for their employees. So last year we conducted comprehensive cancer care for some of the giant IT companies, and then there were a couple of them, and we conducted this preventive mechanism for their employees, that's the women employees, then the spouses, as well as mother and their children also. And the program was focusing on breast screening, cervical screening, and the prevention mechanism as part of the vaccination also. And what I meant to say is that the adaptations have started coming well from the corporates, unlike before 1 or 2 years where they were just talking about creating awareness. But now the companies have started investing on putting money for the preventive mechanism. So that's a change has happened. And the more we see in the coming decade, I see all the big corporates will start investing heavily in terms of their wellness, because they have seen that out of 100, even if one employee, if detected, early detected for any of the cancers, we are talking about huge in terms of life expectancy, in terms of productivity, in terms of giving back to the family. Now coming back to the bottom of the pyramid population, government has started creating awareness about screening for breast, cervical and oral cancers as part of the NCD campaign. And here where we see a good shift that government is, wherever government is not able to reach to the last mile, many corporates have started coming forward to support the rural and urban slum population in getting their screening done and ensuring that the whatever is detected early, getting the treatment also done early. So the full spectrum is coming in terms of public-private partnership model, where government is also doing their bits, whatever they can do. Corporates are doing for their employees, and corporates are doing for their CSR features also.
Thanks, Jignesh. Dr. Chatterjee, do you feel that, preventive medication, particularly in our country, it's more targeted towards the pediatric population than the adult population?
Yes, of course it would be, because that's the low-hanging fruit, and parents are very concerned about their children. But as we age, dementia, popularly Alzheimer's, Parkinson's disease. So therefore, there is enough and more research going on. I have promoted a research with IIT where we are trying to ensure that can we predict the fact that you're going to get Parkinson's disease maybe 10 years before the system set in. So there's something, you spoke of genomics. Well, there's something called proteomics. So proteomics is a small fraction, very fragmented amount of protein which is released maybe 8 to 10 years before the onset of disease. Right. Now, if you diagnose that, or you can pick it up, then there's something called targeted therapy. And you can target that therapy and possibly delay the onset further. So therefore, typically, these sort of disorders are on the horizon. Now, today we are the youngest nation in the world. Give it 20 years and where are we? The average age of India is about 24, 25. Give it another 20 years, where are we? So therefore, we are going to be the oldest nation in the world. And you're not focused on the elderly. You see, now just look at our insurance, health insurance, right? No low premium when you're young. You can earn, you can work. Why don't you pay a high premium? And when you can't work, premium is high. Now look at the lopsided policy. So therefore, if you say that it is risk mitigation, then in that case you must understand that the youngster is not going to fall sick. But when he is in his dotage, he will definitely fall sick. At that time you give him that whatever the no claim bonus or make it all free. You need to think.
I get you.
You need to think. You need to think. So why are you going for the low-hanging fruit? Yeah, because we want to build a healthy nation. Think, man. You're going to be the oldest nation in the world in 20 years. And then...
Yeah. I mean, therefore I mentioned that, it's more of the pediatric population where you talk about preventive medication and vaccines, where you talk about pneumococcal vaccine. I think most of the lung diseases is because of the pneumococcal vaccine. And the patient shifts to the ICU.
And the fatality is very high.
Pneumonia.
I'll add some of the points here. So here, it's not just that India as a nation who has, built the ecosystem around children-based prevention mechanism. In the last 3 to 4 decades, if we see the entire ecosystem has become, and there are reasons to it. And within this ecosystem, I'll say that some of the part has been played by the healthcare professionals also. If you see, our industry has become the pediatric-driven industry when it comes to vaccination. And vaccination is only and only done by pediatricians in the private market. Because of which, but prior to that, MBBS or MD physicians, which are our family physicians, they are not doing vaccination. And because of which, they are not talking about vaccination for their the family as guardians, for the elderly or for the adult, despite that there are various vaccines available. How many do you know that there is a vaccine available for adult for typhoid vaccine? We all eat outside and we get infected because of typhoid. But typhoid vaccine is available, which is hardly around 1,500 or 2,000 rupees. And it is a single dose vaccine. How many do we know that now in elderly or adult, pneumonia vaccine is also available, as you are mentioning about it? So this is the irony. And then when we get sick for shingles, after people getting sick because of shingles, people start hunting that, oh, I was not knowing that there was a vaccine about it. And none of the doctor of that patient knows about it, there is a vaccine for shingles. But he's trying to minimize the pain. So overall, the industry also has adapted, but it is the time where we all collective has to, come back to it. And for the matter of fact, I'm glad that Government of India, Niti Aayog, last year has announced reforms for elderly care. And they have mentioned about various vaccines. So my point is that the first step has been taken. Recently, Kerala government has announced the budget for 50 crore for pneumonia vaccine for elderly care for the bottom of the pyramid population. So it is happening. Despite we being a developing country, things are happening, and that's what I see in the next decade. A lot of things are going to happen for adults as well as elderly care also.
I think to take a cue from here, it's more about public-private partnerships. I think if we really have to have a better healthcare scenario in our country, it's more about the public-private
it's good to talk about public-private partnership. I was the first one to have done a public-private partnership with the government of Navi Mumbai and the Hirnandani Fortis Hospital. That was a public-private partnership, which was done by me. But the political maturity must be there. You can't have a big brother breathing down your neck all the time. I know my business. I am supporting you. I'm bringing in the latest technology. For God's sake, let me breathe. So therefore, as a group, we withdrew. We said, to hell with it. We are not interested in, petty bureaucrats coming in every day. ये अच्छा नहीं है. वो ठीक है साहब, अगर अच्छा नहीं है तो फिर मैं इसको सुधार देता हूँ. नहीं यार, ऐसे कैसे हो सकता है? And now you understand what the hell he wants. It's not possible until you have political maturity. They have to be mature enough to understand we are equals. I'm not big brother. You may own the land. What happened to Seven Hills Hospital? It was a vision for Asia.
Yeah.
It wasn't a vision for India.
Right.
It was a vision for Asia. What a fantastic setup.
True.
Down the drain. So therefore, if you don't have the political will, and you don't have this thing that, big brothers come here, then it will work. Otherwise, it will not work. You need to have the maturity. And this maturity, I'm afraid, is lacking.
So
I would say it's
Jignesh.
evolving.
Evolving.
It's evolving, yeah.
Yeah.
And then I would say evolving in many terms, but yeah, it is taking time. So even India has started understanding that healthcare expenditures are no more expenditures; they are investment. They have started learning from developed countries. And that's where a lot of things are coming up. Even BCG is about to get it rolled out nationwide for adult vaccination also. There are, as I'm part of the advisor in the Ministry of Health and Family Welfare, so I know some of the things as we are part of NCD program also, cervical cancer elimination program also. So one of the program is very beautiful program where government is working on the back doors in terms of surveillance for infectious disease. This is about getting ready and then how we can, prevent a new pandemic in a bigger way. So things are happening and government is putting a lot of efforts, but a lot of efforts, I would say, it's evolving. And that's what we will see in the coming decade. That's what my belief is.
Yeah, Jignesh, I think we are at a nascent stage. It is evolving. I think the only positive thing which is happening is that even the pharmaceutical companies, the healthcare sector, they have all become one now. It's one voice which is there. Otherwise, it was all silos, pharmaceutical companies different, the hospital sector different, everybody. But now there's a common cause which is there, for which everybody is really working upon. And I think that, yes, there will be situation.
Just adding on to your context, last week I was there in Kerala. The invite was there from the Kerala government and from the Goa Institute of Management. So there was a consortium was being organized where the pharmaceuticals, then the hospital partners, then the government partners, and the SSG Management Institute, Goa, GIM was there, and a lot of healthcare innovative providers were also there to understand that how we can go about and learn from one another states' interventions, which we can replicate in other states.
Yeah.
So what you rightly said, it's
Yes,
happening.
some of the states are taking. The other thing which is happening and evolving, as you rightly mentioned, is that it's not only the healthcare companies but also FMCG companies and, like, for example, levers also trying to promote health for all, whether it is PNG, these type of companies are also joining hands. And I think this will make the private-public partnership more successful in the years to come. Thanks. How can India build a community-driven healthcare model similar to those seen in advanced healthcare system? Jignesh,
So, taking cue from your previous point, the Indian government has done lot many things. One of the good example is the PSUs, or the Prime Minister Office has a mandate to all the PSUs to invest 60% of their CSR in health. This is one of the big things which we do not know because these things are not coming in public, but it is happening. Just assume that PSUs, if you cumulatively, if you talk about the CSR spend, it would be more than 5,000 crore. So that out of those 5,000 plus crore, 60% is going to health. Secondly, every PSU has given a mandate to do their CSR investment in one or the other aspirational district. So if you talk about Maharashtra itself, we have 4 aspirational districts: Gadchiroli, Nandurbar, Wasim, and one more. So my point is that the community-based program are already happening in the aspirational districts, which are as such backward in nature, having more tribal penetration. So it is happening, and a lot of community-driven programs are also done by us also when it comes to one of the other aspirational districts as well as rural programs.
Right. Thanks. I think my friend has already alerted me. So I think let me conclude. We are looking at a new era. I'll take just 1 minute. Looking at a new era, the future of healthcare, which is 3 Ps, which I call, and I talk at various forums, that one is personalized, the other is predictive, and the third is proactive. I think most of the things on healthcare gets covered by this. Resilience requires a shift from siloed approach to a network, technology-enabled, and human-centric system. I think you might have observed I have never been biased to technology, although I embrace technology. I am neither biased to human, but I am also inclined to talk about that it needs to be an amalgamation of the human mind and the technology. The technology can be facilitator and nothing more than that. The final thought is that the ultimate goal is a sustainable future where health, wealth, and well-being are mutually reinforced. And therefore, for the payers and employers, focus on preventive, value-based care to manage long-term cost. Understand, health is the most expensive thing. We need to manage it early to prevent long-term costs. For providers, adopt AI for operational efficiency and transition to home and ambulatory care. And for policymakers, strengthen public health infrastructure and data sharing protocols with more of EMRs, as it was mentioned, like the Aadhaar or the PAN. You go across the country, any hospital, you just swipe it, and all your records are there. I think EMR is, it's high time that we get into that. I know it has started in AIIMS and the government hospital, but I think more number of AIIMS should be there. So thank you, Jignesh and Dr. Chatterjee. It has been fantastic.
Thank you very much for coming to the show.